I'm Dr. Ashwini Joshi. I'm a consultant physician and diabetologist at Aloha Lifestyle Reversal Clinic. Today we are going to discuss on a very interesting topic, which is adult immunization. We as parents have been immunizing our children from the day they were born. We immunize them for tuberculosis, for oral polio vaccine. And as we grow, we feel that there is no need of immunizing the adults. But that is a myth. So there is something called as adult immunization. Now what is this immunization? It is a process by which we are able to prevent any infection from happening to ourselves. And it has been proven worldwide that it is the most effective way of keeping away the infectious diseases. We all know the non-infectious diseases like diabetes, hypertension, heart disease. They all happen because of lifestyle changes. But infections, they happen because of viruses, bacteria, various other pathogens. And hence, we have to prevent these diseases. Prevention is always better than cure. And immunization helps us achieve that goal. Globally, over 2 to 3 million deaths have been prevented by proper immunization in adults. And it is done with the help of certain vaccines. Now, what is a vaccine? Vaccine is a modified bacteria or virus or a toxin which is secreted by these viruses and bacteria, and it is injected in a very small amount in our body. This helps to form certain antibodies or chemicals which are able to fight this infection later on when we are exposed to such bacteria. As if the body prepares in the form of a mock drill. So if there is a fire in a company and the company trains their employees how they will handle this fire, then actually in real life, if this emergency comes, the employees are tuned to take care of that fire emergency. Same way, vaccines act on our bodies. Vaccine is the most easy way or a very reliable health investment. So if we are able to prevent diseases like pneumonia, like tuberculosis, like say herpes zoster, like meningitis, because the cost involved in treatment or cure of these diseases is way high. And the cost is not only financial terms, but loss of our work hours, the morbidity which can arise out of it, everything adds up to it. So the best way to take it forward is to immunize adults. Let's look at certain vaccines which are available for adult immunization. Now there are viruses for flu or influenza infection. Influenza is caused by a bacteria known as H. influenzae B, as well as by viruses. The most important virus is H1N1 virus. In 2009, it was a pandemic again because of this swine flu virus. So that is incorporated in this flu vaccine. Also, there is something called as H3N2 virus. Then there is influenza type A, type B virus. And these 4 types of viruses are combined together in one vaccine known as flu shot or a quadrivalent flu vaccine. These viruses are extremely smart. They keep on mutating or they change their genetic structure every year. So the World Health Organization has formulated or keeps on formulating new vaccines every year. So every year we need to vaccinate ourselves against these viruses. Along with that, there is a set of pneumococcal bacteria. The word itself says pneumococcal, pneumo is lung. So anything infecting the lung, these bacteria infect our lungs and they lead to very bad pneumonias, especially in certain group of individuals, which I'll tell you later. So if we want to prevent this pneumonia from happening, then pneumococcal polysaccharide vaccine is a very reliable type of vaccine which can prevent this pneumonia from happening to our body. Then there are certain vaccines which can prevent hepatitis. So hepatitis means infection of the liver. Now viruses which cause hepatitis are hepatitis A, B, C, D, E. But vaccines are available for A and B. Coming to hepatitis B virus, it is transmitted through blood products and also through a sexual way of transmission through the exchange of body fluids. and it is a disease, or it's a virus which causes a chronic damage to our liver and eventually sometimes leads to a liver cancer. So if we don't want to get into that type of a problem, then it is always recommended to vaccinate with 3 doses of hepatitis B vaccine. Likewise, we have hepatitis A. It's a viral infection of the liver which is very commonly seen because it is spread through something called as fecal-oral route. That means the virus mixes with our food material and through water, and if by chance we consume that type of a food, then one would get hepatitis A. Patient comes with fever, jaundice and extreme malaise, and there is a loss of appetite, and the illness goes on for 2 weeks up to 4 weeks. Generally the patient recovers. But if someone wants to prevent it from happening, then hepatitis A vaccine is also available. Then there are vaccines for especially females. We have a human papilloma virus vaccine. The human papilloma virus leads to cancer of the cervix. So females of the reproductive age are recommended to take this HPV vaccine. Then the list goes on. There is a bacteria which causes something called as meningitis. Meninges which cover our brain, sometimes they get infected because of a bacteria known as meningococcus. And it is a very disastrous disease and it is a life-threatening medical emergency. It comes as epidemics generally in northern India. So certain group of patients are more prone for getting this meningococcal infection, and it is recommended that they receive this meningococcal vaccine. To take the list forward, there is a herpes zoster vaccine or a varicella vaccine. Now, zoster is a very painful rash which comes on our skin, and it sometimes infects our nerves and may get complicated to infecting our spinal cord or the brain. And it is a very troublesome kind of an illness, but we can prevent it by taking this varicella zoster vaccine. Especially those who have never got chicken pox in the past, they are recommended to have this vaccine, because the virus which causes chicken pox and herpes zoster are one and the same. That is the reason why. Then to take the list forward, we have vaccines for prevention of tetanus, we have vaccines for prevention of measles, mumps in special situations. So these are also adult vaccines which are recommended. Now, with the help of vaccines, you will realize that there are certain disastrous diseases which we have been able to eradicate from the globe, like smallpox. Smallpox was so rampant in 1900s and in 1800s, but scientists like Edward Jenner, they found out a vaccine against smallpox, and it led to very nice eradication, and after 1980 there has not been a single case of smallpox, and it is because of a very good campaign run by the World Health Organization to eradicate smallpox. Likewise, in 2014, India has reached the phase of eradication of polio. Polio is a disabling disease, and with a very nice campaign of polio eradication, we could achieve that target. So if we are able to vaccinate particular group of individuals, especially in adults, we will be able to prevent such diseases. Now your doctor will decide what vaccine is recommended to you, and the decision is to be taken as per categories given to us by the Center of Drug Control, which is there in United States, and it gives the guidelines, and the individual is grouped into the various age groups. So somebody who is beyond 65 has got a particular set of vaccines which they have to take. Somebody is less than 50, a different set of vaccines, and between 50 to 65 there is one set of vaccines. Along with that, if otherwise we are healthy, and then we have to categorize ourselves in these age groups and decide the vaccine. But if we have certain comorbidities, then we have to be really careful. The comorbidities are like anybody who has diabetes, heart disease, chronic liver disease, lung disease, renal failure, liver failure, or they are healthcare professionals, or they are immunocompromised, suffering from human HIV infection, or they are pregnant, then the set of vaccines is different. So today's talk was just to give you an idea why adult immunization is important, and by the end of year 2020 I suggest all of us should be aware that we need to vaccinate ourselves against certain diseases. Meet your doctor soon and get yourselves vaccinated. Thank you for your patience.